Hi, this is Dr. Chris Lauria from Disc Centers of America in Roanoke. Happy New Year's to all. This is my first live stream of 2026. Amazing how fast it goes. But I had a patient come in today dealing with bad sciatic pain. And sciatica is irritation of the sciatic nerve that runs from your back, from actually 4 levels of your spine. They all join together and form a large nerve that runs all the way to your feet and toes. When we dissected a body, the size of the sciatic nerve was just a little smaller than a pinky. So it is a thick nerve at the top, and as it gets lower, it spans out, gets less and less as it runs down your leg. Sciatic pain can be debilitating. There's a lot of different causes of sciatic pain. And one of them that I hear a lot from this patient today was my doctor, physical therapist, told me it's my piriformis muscle. I have sciatica due to a piriformis muscle. Well, that can definitely cause sciatic pain. In the bottom of your pelvis, there's a small muscle, and it's kind of like the size of your fingers, maybe less banded together. And it's called your piriformis muscle, and it plays a role in allowing proper motion and function of your pelvis, hips, plays a role in walking and things like that. Well, it just so happens as the sciatic nerve comes down and exits your pelvis, it goes through a hole in the middle of your piriformis muscle. And as long as things are normal, it travels through that muscle. It never irritates it. But certain things can cause that piriformis muscle to tighten up or spasm up. And when that happens, that hole that it's formed in the piriformis can close up and cause those symptoms and irritate the sciatic nerve and cause sciatica. And it's definitely a cause. Now, there's simple stretches. Physical therapy can be done for something called piriformis syndrome. Now, the person had been doing piriformis exercises, physical therapy for 6 months, and her sciatica didn't go away. Well, the key is, and as I always tell everybody, you got to find out the cause of the problem. And there has to be a reason why that piriformis muscle is tightening up. Is there a structural problem with your spine? Is there a structural problem with your pelvis that's causing the piriformis to spasm up? There is a reason why the piriformis muscle is tightening up. And the key is to find out the reason. A lot of times we find out it's degenerative, bulging, ruptured, herniated discs in the spine that are causing the piriformis to compensate for those type of things. And if it doesn't go away with the simple stretching, physical therapy to reduce the spasm and tightening of the piriformis muscle, then there's another underlying cause. And that's what we do, is we want to find out our underlying cause of piriformis syndrome. And if we can correct that spinal problem, disc problem, pelvic problem with our laser, decompression, vasopneumatic therapy, and those type of things, we can get rid of the cause of the problem. And when we do that, the piriformis muscle will relax and the sciatic pain will go away. So just a simple explanation of that as to what might be causing your piriformis syndrome. If you're someone that's dealing with sciatica and you're doing the stretches, you're doing all the things to try to reduce the piriformis syndrome, and it's not going away, then the piriformis muscle isn't at the cause of the problem. There's some other thing going on that's causing this. If you'd like to find out what that is, let me see if I can get this set up. You can call our office. Look at that. I don't know why it's pink, though. It's supposed to be red. But you can call our office at 540-725-9501. We'll do a complimentary consultation and exam to see what's causing this, see if I can help you with it, or we can refer you to the right person to get this problem taken care of. Hope this was beneficial. We'll be back on again soon. It's Dr. Chris Lauria from Disc Centers of America in Roanoke. Thank you.